Hi, my name is Amy Kossik. I am just starting the MSN program. This is actually my first class, so I'm really excited to finally get started. I've been talking about going back for my MSN for a while, so I'm really excited that I'm finally doing it. I am currently working as an infection preventionist at Reading Hospital in Pennsylvania. So it's about 900 bed trauma 1 facility. So we do get all kinds of patients coming in. We see all kinds of stuff, and we're the biggest hospital in the area, so we do get just about everything within the county. In infection prevention, I do a lot of work, obviously trying to prevent infections in the patients and the staff and everybody that comes into the hospital. So I work a lot with isolation precautions. So you can imagine that I've been quite busy lately with the coronavirus stuff that's been going on. We meet 2 to 3 times a week because things from the CDC and the Department of Health are constantly changing about what we need to do to protect ourselves against coronavirus and to help prevent the spread of it. So we work as the liaison between the CDC and the Department of Health and the hospital so that we can get that information out to everybody and come up with policies and procedures to help protect everybody that comes into the hospital. So right now we're working on a lot of emergency preparedness and outbreak preparedness, and trying to figure out what to do if we run into a shortage of supplies like masks, because that is definitely an issue. When there's not an emergency happening, we also do a lot with hand hygiene, and we look at other policies and procedures throughout the hospital to see if we're following the latest evidence-based practice so that we can prevent infections in our patients so that they are safe when they come here. We also review all positive cultures on patients in the hospital to see if the patient got an infection that is related to our facility. And then we will communicate with the doctor and sometimes even the patient if there is an infection related to the facility. So there's a lot of chart review, a lot of data. There is a little bit of patient interaction, but it's not like it was when I was a clinical nurse. In my personal time, I have a 1.5-year-old, so I don't have a ton of spare time, but when I do have free time, I do anything I can with her. Our latest thing is swimming lessons, so we go to the pool every weekend and we practice kicking our feet and blowing bubbles, and it's so much fun. We also have 2 dogs. So we love to take the dogs outside and go on nature hikes and explore new areas whenever we can. And my husband and I, we also really enjoy traveling. So if we get any kind of time, we try to go out and explore new places whenever possible. Lately, with a 1.5-year-old, it's hard. So we've only really been going to as far as like the Delaware beaches. So we're due for a nice big trip again. As far as my professional life, I really enjoy the quality side of working in healthcare. So it's something that I didn't really know a whole lot about before I got into infection prevention. But I like that we take the practices that are currently going on in the hospital and we make sure that we're following all of the regulations and that we're up to date with all the current guidelines. And we make sure that if a surveying agency like the Joint Commission were to come in, that they'll look at our practices and say, yes, you are actually giving very good care. because your staff can be out there giving the best care to the patients, but if you didn't document this the right way, or you have a little bit of dust in this cabinet over here, it can make you look bad and like you're not doing what you should be doing. So I really enjoy being able to make sure that we are up to the level of quality that I think all healthcare agencies should be at. So with my MSN, I plan to move forward in quality and patient safety and risk management to try to get more involved in that and take what I've learned in infection prevention and apply it further. I really love it, especially regulatory. Regulatory is probably my favorite area, believe it or not. So I would love to get into a regulatory role or a patient safety role, or possibly even director of quality or something along those lines. Big dreams. So I'm really excited to meet you all and to work with all of you, and good luck.